Well, to Artist in Recovery and Bo of the Fifth Column, welcome and morning, gentlemen. West Coast time, it's 8:43 in the morning for Wednesday, the 28th of February, 2024. If we didn't have this leap year situation happening at this point, it just would have been the end of the month, but no. This particular end of the month, I had been checking out a few videos that's been catching my attention a great deal in this one. We keep talking about America. Have we ever talked about our Canadian neighbors, about what the hell's going on over there? A few topics comes to mind. Socialized medicine is not exactly what it's cracked up to be, especially when you have a family doctor getting out of the business after so many years that she's getting buried alive with the damn bureaucracy. The paperwork's killing her. She can't hardly ever see her people. She's got to maintain records all the time. But she doesn't have the financial necessary to keep up with it. I've been going on this tube site called City News that deals from one side of the continent of Canada to the other side of the country of Canada. And these things have been popping up on my radar. The concerning about the doctor closing her practice permanently. I mean, she's getting out of it. She's a skilled doctor, but she can't deal with the socialized medicine crap going on over there. And I think she's going to move out of there. Getting the hell out of there. She's not making the money enough to support her staff. There's not enough funding coming in to support her staff. She don't have any. Um, no staff. I mean, maybe a nurse or two, but even they've been let loose, and she's gone at the end of this month, or maybe next month anyway. But she's leaving and making the other people scramble for other patients. It's a long waiting list for bureaucrats to get the gathering paperwork necessary to do a medical review and then decide whether or not it's going to be done for a specialist or not. She has to keep filing the paperwork into the bureaucracy to make sure that there are specialists out there to take care of her patients. She's only a family physician. She's like a general practitioner. They can do the generalized work. I'll take care of a little bit of your ear cleaning if necessary, or see what's going on. Maybe prescribe some medications to clear up something generalized that a family physician would take care of. If you need more specialized care, well, that's for another doctor to do. In order to do that, you got to go through the bureaucracy. Now, with the health insurance companies we got regarding the PPO and the HMOs throughout our lifetimes, we had to deal with the bureaucracy left and right. If we actually had the PPO, we can go to in network and out of network. But recognizing that there are deductibles, out of pockets, maxes to meet out, not to mention the percentages. And if it was straight HMO, you go within a network and have to go through that HMO group to get the authorization necessary for the physicians in that network to get the services. Otherwise, you're going to be stuck with the out of costs. You're going to be stuck with the cost outside of that network, especially if they're out of network. I mean, you only heard about the weirdest damn thing about the HMOs at that point that I remembered a long time ago, probably up to this point. And it's scary as hell. It's like within a 10 or 20-mile radius of your work or from your home. You can go to doctors in that area. Can I show you guys something? I'm o- Yeah, she did that on the floor again. Thank God for the damn pads. All right. Excuse me. Yeah, throw problems again. He knows, artist knows what I'm going to say. Shall we refer to the Google Maps? Well, I know artist is going to do it. Are you going to do it, Bo? Bad enough I'm looking at damn maps concerning about Texas going up in flames. Panhandle and then Oklahoma next, or FUBAR. Okay, so I'm going on satellite here. Okay, I'm getting back to my old territory of home, which is California. I'm going to use, well, if I happen to use this particular area, it's going to scare the hell out of me, and the HMOs don't cover this area, only the PPOs. San Fernando Valley. Well, I actually had insurance there for a long time. Now, you know, it's about 20 miles, almost radius, almost. If you look at San Fernando Valley, California, you see how densely packed it is? I mean, hell, you can work one end of the valley and go to your doctor on the other end of the valley. Being covered. You're still in area. You're still covered. PPO, if you're in network, which means you're in a network of the medical insurance itself, you can go anywhere, still pay the percentages, the deductibles, the out-of-pockets. As long as you got a certain level maxed out, then you can do the percentages. If not, you got to max it out, then hit the percentages until, oh, did I say that there's a lifetime max on this damn thing before you get a new policy? Those damn things piss me off all the damn time. But within the network, and once you get an authorization, or do you need authorization? Not for specialists. Not necessarily, but if they're in network, it'll be no problem. But out of network is a pain in the ass. Say, for example, if I happen to get, and this is lovely with the PPO at this point. Let's just say, if I'm going to scroll into the San Fernando Valley, a densely populated area. Look how densely populated the whole damn thing is, okay? Try this one. Scroll into a neighborhood. Focus on the 405 freeway, okay? And just kind of scroll right into the middle of it. See how densely populated that is. I'll throw you a bone on this one here, guys. Try this for a weird one. Everything you think is connected and networked, right? Wrong. There are doctors, there are medical facilities in this valley here that are not in network. And others are. Only you wouldn't know that unless you asked them. Let's scroll into a residential area and I'll give you something. Just right along the 405. Let's stay about, close to the Van Nuys Airport. That long stretch of runway right there. Okay? Hang on. Hang on. You try taking care of a dog with dementia. Let's see how you guys survive this one. Oh, I love that dog. Anyway. It's commercialized, isn't it? All that nice juicy area over there. No medical facilities. Just residential and business. But you don't know which one's going to be networked, who's carrying the network coverage, or out of network. What? I didn't show you any medical facilities? Oh, okay. Well, let's show you a medical facility, shall we? Roscoe by Reseda, or no. Sepulveda, Van Owen, a hospital. Right, where the hell is she at? Okay, down a bit. Go to Sepulveda Boulevard. There should have been a hospital. Where's the permanent? Let me tell you, that's old farts kind of forget where the hell we've been, especially when we're out of a neighborhood for part of a lifetime. Take me a hell of a long time trying to recognize certain hospitals in the area and how other hospitals have, quite frankly, disappeared. One of the hospitals that I would use as a landmark all the time is called Valley Presbyterian Hospital on Van Owen Street, right by Sepulveda. Of course, it doesn't mean anything to you, but to me, the patients, rooms, residents would be recognizable even from a map, sometimes even for me. But I was trying to make a An example here, some hospitals would be contracted and other times are not. But mostly to nearly all the hospitals out there, the larger ones, are hooked up with insurance companies left and right. Now, if they didn't, the patients would be paying out of pocket, and it's an expensive situation right there. HMO, certain hospitals will be contracted with, and there's also specialized hospitals. You heard of the Kaiser Foundation? Yeah, try to be part of that one there. Let's see here. There's Roscoe and Woodman. Yeah, I'm on it again. At least certain hospitals I wouldn't recognize the locations of in the first place. Crisscrossing the valley like crazy. It just makes me more concerned about a lot of things. Nostalgic, actually. I get into these kind of situations here. I get nostalgic for the old days. Unfortunately, that's the curse of getting older and older. That's the curse. Alright, Kaiser Foundation, where the hell are you at? You're supposed to be over at Woodman and Roscoe. Roscoe Boulevard. And you're supposed to be in an area that I can actually recognize at this point. Don't be surprised if I happen to turn off the recorder again because my mother will be screaming for me. My little dog. There she goes. You're alright, Mama. You're safe, baby. She's got me worried. I suppose we're going to have this conversation another time because my attention's getting drawn towards her. I was trying to find, and the changes of the San Fernando Valley has been mutated so much. Maybe it'd be a hell of a lot simpler for me just to pick on Antelope Valley because it's a lot more simpler than that. The Antelope Valley being the wedge-shaped thing right above the San Fernando Valley on the northeast quad, huge area. You got Palmdale and you got Lancaster, and there's only one hospital in Lancaster. There is only one hospital in Palmdale. We got over 1 million people in this place, stretching from Mojave all the way down to Little Rock. Keep that in mind. One hospital in each city. We got about more than 4 or 5 hospitals in the San Fernando Valley. 3 or 4 million condensely packed, but there are hospitals. There's maybe 1 or 2 trauma centers. Northridge Medical Center and Providence Holy Cross. Providence Holy Cross will be in the Granada Hills, Mission Hills area by the 118 freeway, northern area. Northridge, well, they're buried in the San Fernando Valley in the middle of the area. They're on Reseda and Roscoe area. We also have Providence St. Joe's out in the southeast quadrant by Burbank, the Burbank area over there. That's also a trauma center. But it's a major hospital hub as well. Then smaller surgical centers, smaller hospitals. A couple of contractor hospitals I was trying to tell you about. The one by Roscoe and Woodman in Roscoe was a Kaiser facility for Mission Hills. Is that Mission Hills? I guess. Yeah. But there's also a Kaiser facility on the west end for the Kaiser members. Canoga area and Oxnard, I believe. In those quadrants, we have 1, 2, 3, 4. About 4 or 5 hospitals in that area. Look how the population density is in that, and how how it's scrunched. We also have another hospital out in Valencia, Santa Clarita area. We can do airlifts out to Los Angeles if necessary for several other hospitals out in that area. A lot of them are contracted with a lot of insurance companies, regardless PPL or HMO situation. So whatever hell you are, you're supposed to be covered and taken care of, most part. But sometimes the hospitals will fall away from the insurance companies and disassociate themselves. So let's just say you went over to a hospital already. I was going to point out to one particular hospital. With all these major hospitals out here, the nearest medical emergency room would be a contracted facility. But I'm sorry, what's your insurance company again? Your Kaiser? And you're coming all the way from Burbank? By the Burbank Freeway? No, 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 no. The Hollywood Burbank Airport? And your Kaiser? Here's the thing. Hospitals have to stabilize your ass. They stabilize your ass. And then they stabilize you for the transport to wherever contracting hospital it is, if you're going to live or survive enough. They the paperwork has to go through. They have to contact the insurance companies to see if they get the authorization necessary. Case management has to get involved. Utilization's got to get involved in this situation over here. Isn't that fine? Regardless if you're PPO or HMO, if it's an out-of-area emergency, or if it's basically an emergency. Okay, bow of the fifth column. Let's just say you had an accident and your ear is lopped off. You're visiting from New York to here. What's your insurance company? Oh, XYZ? Well, we'll get you over to the emergency room. We'll stabilize you. I'm not quite sure if we're going to save the ear, but we'll try anyway. But let's just say you came out here to California for a visit. What insurance did you have? HMO? Oh, PPL? If you're stuck with an HMO situation at this point, you will be covered by the out-of-area emergency situations that most insurance policies will probably have. You'll be seen and treated in the ER and probably pay an out-of-area copay for that one, if you argue with them successfully on that one, all right. But as for the hospital stay, it's going to be up to you and the insurance company to hammer this one out. The hospital will ask for authorizations, whether or not you're actually going to be taken care of, maybe for 1 or 2 days of stabilization, or maybe 3 or 4 days. That's a pretty penny right there for the out-of-area emergency, losing your ear. Of course, it was an accident, wasn't it? I mean, you got off the plane and something hit your ear, and then you were bleeding all over the damn tarmac, so they got 911. Let's see. City of Burbank? No, not quite, because you were still in the LA territory a bit. So Burbank would probably not cover you, but City of Los Angeles or County of Los Angeles probably would, and send you to an emergency trauma center. St. Joe's will be the closest one in that territory, maybe. Well, you sure as hell ain't going over to Providence Holy Cross. You're not Catholic. Well, it is an emergency trauma center. And if you're Catholic, you may be okay. I'm not trying to be racial. I'm not trying to be cutesy in the situation. My grandmother was Catholic, and she was treated over at the place before she passed away from a stroke. But it is still a medical trauma center, and that's still in the northern part, and I don't think they're going to be traveling you over there. They may get an air vac, a medevac going on you. Is St. Joe's available? They're full? Okay, well then you got to go to the next trauma place that they can still get you stabilized enough. Northridge, well, that's halfway across the valley. But if that's the only place with available emergency room and a bed, you're stuck. So now you got air transportation. So they fly you over to Reseda and Roscoe. All right. I said before, it's been a long while since I've been on my own damn home turf. 38 years to think I would know everything over there, but you stay away from there long enough. My God, you lose your minds, dude. You lose your mind. Alrighty, here we are. You just got landed on the emergency helipad, and they're taking you to the emergency room. They get you stabilized through the AirMed services, private company. Not well, they had to use an AirMed services. County and city were tied up with other resources. They may have been a fire or other rescue, so the other choppers were not available. They don't do police choppers. So the private company, now you got charged on that one there, takes you over to Northridge Hospital, and you get stabilized in there. Okay, 3 or 4 days. They got to contact the insurance company. The billing department has to contact authorizations, actually verification to see what kind of insurance you got. And see what are not kind of benefits that you have. Once they qualified your ass, then they check you out. Oh, you got out of area emergency for a short time. 5 days if you're lucky enough. Maybe at a $100 or $200 copay per day at this point. Member services for out of area. You went through the ER. You got admitted. Probably waive it right there or charge you on that one, depending on how the billing's going to be going at that point. But that just covers the bed per day. It doesn't cover the additional charges, such as medications at this point over here. They cost. But let's just say to get you stabilized enough where you're actually able to travel. Complications. Uh-oh. What'd you do? Develop a bacterial infection in a damn ear? Ooh. Antibiotics. Okay, 5 more days on that one. Ka-ching, 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 ka-ching. Hello, member services. Well, you want to complain that you're at a hospital charging you too damn much? Well, you're over there because of a medical emergency, sir. But these are your benefits that you have for this. You have this, and this. Your hospital is on contracting with our network. So there may be customary and reasonable expenses. Percentages. Percentages that the insurance would be covered, actually the hospital would be charging the patient for. Because you're totally out of network on the HMO. Okay, same situation. You got transferred, but let's just say you didn't have HMO. You had PPO. Gonna be a long video. Okay, PPO. Let's just say that your hospital is contracted with your insurance company. But that's going to be a stretch right there, isn't it? Out of area would be it because you're from Florida and you're coming over here. Oh, why don't you use me? Well, why don't we do this one in the next video? Save you the bill just yet.